Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright Kevin, tell me what's going on with your elbow, what happened?
It's elbow pain when I do extension.
Okay, how did you hurt your elbow?
It's from weight training, I believe.
Okay, how long has this been going on?
About 4 months.
4 months ago. Did you have any treatment?
No.
Okay. So, can you describe your symptoms, what motion aggravates your symptoms, and how much pain from 0 to 10?
Again, when I extend my arm or do a tricep extension, it's just extreme pain.
Okay.
With weight, it's even worse. I mean, up to a 10. If I get lightweight, it's bad.
How much pain, like if I have you to do it now, tell me from 0 to 10, how much?
I know it's about, I think it's 6.
Okay.
So 6, 7.
Where do you feel it exactly?
Right.
Is it on the bone or you feel it in the tendon?
It's when I extend, it goes to over the bone.
Okay.
But prior to that, you can feel it, or back here is where the pain is.
In here?
Back, yes.
Yes.
But when it
Right
extends, then it's right over the bone.
Okay. Do you feel pain within?
Yes, that's I always
that's
rub it right back in here. I always rub it.
But it's
It feels
painful.
painful.
It's
Yes.
painful to even
Yes,
rub it.
yes.
Okay. All right. Any pain going down to your arms or anything, or up to your?
No.
Okay. So all right. Make sure everything is free. Okay. But doing this motion is fine.
That's fine.
That's fine. Okay. So it's just biceps extension.
Tricep.
Triceps. Sorry. Any problem with that shoulder?
Yes, I got this bad shoulder, bad arthritis.
Let me see your range of motion for your shoulder. Is that as far as you can go?
That's better than I used to do.
Thumb up and bring it up like this straight. How long you been having
That's
tightness
been
in
like
your
10
shoulder?
years.
Let's do the side and up. So for 10 years you have that limitation.
It started probably 10 years ago. It's probably been limit for 6, 7 years.
How did you hurt it?
Just arthritis, just.
So have you had any treatment for your shoulder?
I've had injections, stem cells, and
A stem cell, did you have cortisone shot or just a stem cell?
I don't have any cortisone shots,
Okay. What else did you have?
but just stem cells.
Just a stem cells?
I've had MRIs and they just said it was arthritis.
Bad arthritis there. Okay. That's very limited range of motion, by the way.
No, I know.
That's very limited. So, I'm not surprised you have this issue here you're compensating with. Well, we'll see. Just want to make sure to loosen up everything because that's what will affect your shoulder. Elbow. Is that too much?
No.
Okay. Okay, let's move your shoulder and tell me where is the tightness.
Which way?
Forward. Where do you feel the tightness? And the side.
I mean, I don't know.
Where do you
Tightness-wise,
feel
it
it's
just,
pulling? The back or the front?
I just stops. I can't, it's not
Yeah.
really tightness. It's
There's
just,
not, like, no room to move.
Yeah.
It's like something like in the way, prevent you from moving.
yeah, it's not really a tightness at all.
Do you have the same issue in the other shoulder? Or it's
it's
this one?
100%
You're
good.
left or right-handed?
Right.
Right-handed, okay. So I'm gonna work on the scar tissue now. I'll show you how much scar tissue we have, but just gonna work if it was not here.
Mm-hmm.
Okay.
Actually surprised because it looks like it would hurt.
Mm-hmm.
And
Yeah.
hurt that bad.
Well, if you start to feel pain with that, that's mean inflamed. Like when we touch it here,
Mhm.
that's inflamed. This is very light, like really light pressure. Well,
That's how
when I
funky
put
it is if you-
when I put my weight, it's not light pressure, but if you don't have inflammation, you should tolerate that. That's a sign of inflammation. So I will try now to work on the proliferation stage, just clear up the scar tissue, the fascial restrictions, and see how you respond. If you feel better, you're just purely stuck in the proliferation stage, just take a few treatments to clear up everything. If you still feel pain, that's mean you have inflammation. And I have some tools here to work on the inflammation. If it's mild inflammation, It should be fine with the magnet heal, just a few minutes working on it. If it's severe inflammation, moderate to severe, we need to really do more stuff for inflammation. You have a really thick scar tissue here, the size of your biceps. It's
Really?
the thickness of the muscle. I feel it here superficially. Why I'm doing this? Because, you know, when you contract your triceps, your biceps should be stretching as far as it can. So I have to really clear up both ends.
So it's not pulling it,
Yes.
or a restriction on the other side.
Yeah. More.
Sure.
So I want to see how much I can go without
Yeah.
inflame it. Just it's a very fine line.
Sure.
So we'll see. So you feel how nice and smooth here?
Mhm.
That's fine. There's no scar tissue. Feel this. You feel that grinding here?
Yep.
That's a scar tissue. It should feel like nice and smooth like this. So let's see how much scar tissue you have. That's a scar tissue here. Is that too much here?
No.
So it's more grinding here
Yeah.
compared to
Mhm.
this. So that's a
A
scar
lot.
tissue. Is that painful?
No. You really have to like get in deep for it to hit that spot. So I think you'll be fine with what you're doing.
I'm gonna get there.
No. I'm sure
just-
you will.
relax,
I'm just
relax.
saying.
I'm just actually prepared, like
Yeah.
really try to see how far I can go.
Yeah.
You feel that bump here?
Mhm.
That's all the scar tissue here. Relax your shoulder. In here. So it's all closer, like to the on the biceps tendon here. And you will see more redness where you have a scar tissue. You will see the map of your scar tissue from the redness, and also you feel it. You actually have more on the biceps muscle itself, the muscle belly here.
Mhm.
Here you have a bit more on the triceps tendon. Okay, we'll have you drink some water and want you to move your elbow and your shoulder and tell me how that feels.
Yeah, it seems like a little bit better.
0 to 10, is it totally gone or still feel
No,
something?
I still feel some.
How much
right,
from 0 to
right,
10?
right on the
So
bone.
it's on the right on the bone.
Right on the bone. When I extend it, yeah, it always is.
How much?
And like 3-inch maybe.
So went down to 3?
Yeah.
Okay. We start, you said like 6, 7, now? Okay. So I gotta get to that bone, but make sure it's not painful, okay? In here?
Back just a touch. That's where it gets painful when I stretch. But again, it's like here right now is where I will rub and feel the whatever it is that's painful. So that roughness over the bone is scar tissue.
When you feel like there is natural curvature and there is like bumps that should not be there. That's usually scar tissue if it's not normal anatomical curvature. You know, if it's in the muscle, you should not have those bumps in the muscle, period.
Yeah. I understand
But when we know the anatomy of the bone, there's natural curvature,
that.
but
That should be
you
smooth.
don't see, you just see a lot of bumps like, does that make sense?
Mhm.
So you have natural curvature here, but when you have like a piece of
Yeah, it's rough.
rough here, and especially it's where your tendon attached to the bone, you know, that's usually, it depends on the location and the feel of it. But that should not be rough like this.
Okay.
And you will notice with this treatment, the thickness of the scar tissue and the roughness should be smoothened out. So some patient actually one treatment we can make it flat. Other patient take like a few treatment. It depends on the thickness of the scar tissue and genetics. Some people just genetically they have hard scar tissue, it's just rough tissue to work on. Too much or it's okay. See how strong this magnet?
Mhm.
Okay, so I coat this magnet with anti-inflammatory coating, and when we measure it, it's the range of the magnetic field was 2 inches to 2.5 inches. So that's what I use for inflammation. If it's a mild inflammation, it's gonna take a few minutes just using this. So we're gonna know how severe is your inflammation by using those tools. Okay.
So what's it gonna do?
So, normal cells voltage runs between 25 to 20 millivoltage. So when they measured the voltage of the cells that inflamed, they found the voltage went down to 5 to 10 millivoltage. So think about this way, like your phone battery. If you're running on 5% of your charge, you're just barely making emergency phone calls, not able to use apps. So it's the same thing in the cells. When you have inflammation and have low voltage, you're stuck in the inflammation stage, you're not moving to proliferation to maturation. Cells use electromagnetic currents to communicate. So this is because this is very strong magnet, it's actually increasing the charge in the cell. So this way, hopefully we'll move from inflammation to proliferation to maturation. So I'm using 2 because when we use 2, the range is 4 to 5 inches. So I'm trying to really get to the deep spot that you're talking about.
Okay.
And this is what I usually use for arthritic patient to really put it in the joint. But severe arthritis usually recommend you wear it for several hours because it's gonna take time for severe inflammation. The other way we're gonna do, because you said you have arthritis there. So usually I do nutrition analysis, make sure you are on anti-inflammatory diet, make sure there's no deficiency in anything that actually slowing down the healing cycle. So there's a lot of other options we can do for inflammation and arthritis. It depends on what patient present, because we have to do evaluation. It's not like one size fits all. Because there is natural anti-inflammatory, I can give it to you, but that doesn't mean you need it. If you have deficiency in like vitamins or minerals, the anti-inflammatory supplement is not going to work. Like you had the stem cells, great, but if your body missing D's or B's or other minerals, stem cell will not gonna do anything.
I get blood work every about 3 months, 4 months. 4 months,
okay, that's good. Yeah, can you bring then like your last blood work next time? Just want to take a look at it. How's it sweet?
Good.
Relax.
Seems like I get a tingle up here for some reason.
Yeah.
It seems like
You feel it or it's gone, the tingle?
what you're doing, it seems like I'm getting a tingle up here.
Okay, let's drink more water.
I'm out.
Okay. So, we'll have you drink more water and then we'll try it again. Do you still feel tingling? After drinking the water, check the tingling too.
Well, it's just like, it seemed like you, a certain area or something, I might get it.
Yes. So let's try it. And how's it feel?
It's the same than what it was before.
0, that's 2 out of
It's
10.
2. Yeah.
In the same spot.
Same spot, yeah.
Okay. So is that like the horseshoe that you said? It's like a kind of like
Well, again, when I flex, it's right on the tip of the bone when I flex. But then when I go like this, it's back here.
okay. Let me do the tip of the bone. Okay. Relax, relaxation. Let me know if you feel any tingling, okay? Did you have any bruises there when you injured it, or like you hurt a pop or something
No,
like
no,
that?
no. It just
Mm-hmm.
kind of came on. I kind of felt it. Now it went a little bit easier.
Mm-hmm.
Working my tricep. It just got a little bit worse. Go try again. After about 3rd or 4th time, it got worse, and then I went and I was like, oh my god, I can't.
Mm-hmm.
So I just stopped.
You felt it in this spot. Did you feel it deep in the joint, or just superficial right here?
It's the same thing.
The same spot.
What?
Okay, let's drink more water. We'll try it again. How's that? 0 to 10?
A little bit better. Maybe a little bit better.
Mm-hmm.
Maybe a 1.5, but it's
Mm-hmm.
gone away. Or it's
Yeah. You
getting
see
better.
how this is not. It's a little bit over mild inflammation. Okay, so we can drink more water. And we'll try it again.
Seems like now if I come out, it will start irritating a little bit more every time I do it. But it's so about 1.5 maybe.
In the same spot.
Same, yeah.
You feel it right in here.
Right there. Just right on the end of the bone.
And it's right in here, yeah. Okay. This is a little bit different spot. Okay. Drink more water and try it again.
Yeah, it's
0 to 10.
so probably a 1 now.
1.
Yeah.
In the same spot, yeah.
Same spot.
And that's for. Do you need that spot?
Hmm?
Do you need that spot or get rid of it? I'm just joking. So that is kind of like on the moderate inflammation. It's not too bad, but that is inflamed spot. So for now, I don't want you actually to do any lifting, okay? We'll see how long this lasts.
Okay.
And I'm gonna go over the inflammation protocol before you leave, just to really get that under control. So that's why let's drink some more water and tell you how to.
Jericho is here in his office. So what I do is
Same.
Like 1.
Yeah, but
Okay, that's not bad. I'm gonna work more on the inflammation. So, can you tell any difference with ASTR treatment? What do you think about it?
yeah, definitely relieve the pain
Yeah,
quite a bit. Yeah,
yeah,
for sure.
awesome. So, thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!